Hello, good afternoon. Welcome. Thank you all for being here. On behalf of the Foundation for Child Development and the CLASP, the Center for Law and Social Policy, I want to thank all of you that are here in the room today and all of you that are joining us by webcam. I'm Mark Bogosian from the Foundation for Child Development. The mission of the Foundation for Child Development is to harness the power of research to affect policies that ensure that all children benefit from early learning experiences that strengthen their developmental potential. And that's why we're here today. FCD funded Dr. Donald J. Hernandez's important work, Mother's Education and Children's Outcomes, how dual generation strategies offer increased opportunities for America's families. Hernandez's research offers the first ever analysis of economic, education, and health indicators for children whose mothers have not graduated from high school compared to those whose mothers have higher education levels. The disparities are heartbreaking. Hernandez's research is the jumping-off point for today's forum and panel discussion, which will highlight policy solutions to reduce these disparities. Copies are available here in the room, and for those of you that are watching by live stream, you can find it on the Foundation for Child Development website at www.fcd-us.org. I'm blown away by the enthusiasm that this event has generated. So many of you here in this room, 162 of you have RSVP'd, and it looks like many of you are here. And extremely blown away by the number of you out there watching by the live stream. Over 600 people have signed up for today's event, which really clearly shows how important this work is. Before I turn this over to our moderator, I really need to thank Hannah Matthews, Tom Salyers, and Olivia Golden from the Center for Law and Social Policy, and Alison Boucher and Morazir from Spitfire Strategies. Without their hard work, today's event would not be possible. I also have to thank NPR for the use of this incredible room. Isn't this beautiful? Thank you so much. Marisol Bello, who I will introduce momentarily, thank you so much for agreeing to be our moderator today. It's a pleasure to have you. I do need to thank our very distinguished panel, Mayor Gray, Olivia Golden, Gail Mellow, Juan Salgado, and Dr. Hernandez. Thank you all so much for being here. I now have the privilege of turning this over to today's moderator, Marisol Bello. Ms. Bello is a national reporter for USA Today, where for the past 7 years, she has covered urban affairs, poverty, and social issues. She has written extensively on the rise in poverty and the shrinking of the middle class. Before USA Today, Ms. Bello covered the rough and tumble politics of the Motor City at the Detroit Free Press and the rough and tumble streets of the City of Brotherly Love and the Philadelphia Daily News. But what I love the most is that she's from the Bronx and a Yankees fan. And with that, I turn this over to Marisol, and thank you all for joining us today.
Thank you so much. I'm very happy to be here. I think this is wonderful, and the turnout's just amazing. So very eager to sit here with a very distinguished panel and hear all that they have to say about two generational approaches to helping American families. And thank you to the Foundation for Child Development and CLASP for hosting this great event, and all these folks that have come out to hear this. You know, since the recession, we've had quite a lot of conversation about income inequality and social mobility and record levels of poverty and what's happening to our families. You know, we know a lot of the numbers. Children are 22%, number of people in poverty. We know that we have record levels of Americans, 50 million, living in poverty as well. Can you hear me? Yeah? Okay. Sounds like I went off there. You know, and we're hearing more about more income inequality. It's harder to move up the social ladder. So we're hearing a lot about, you know, you're basically born in a certain income strata, and that's where you stay. It's harder to move out. And so what's wonderful, and I'm very excited to hear about Professor Hernandez's work, is that he's providing us some real data about how outcomes differ for children based on their parents' educational and attainment and their income levels. You know, and it also provides, a lot of his numbers provide a blueprint for what we'd like to focus on today, which is really looking at these two generational policies and approaches that can be had. You know, often these approaches work on separate tracks. You have programs for parents over here and programs for children over here. And what we'd really like to get a handle on today and talk about today is how we can get these two tracks to converge. And it seems like common sense, right? When you think about it, it's like, yeah, duh, you know, if the parent is doing well, the kid will do well. And yet, you know, in talking with some of the panelists before before we sat down and in reading a lot of their work, we're not seeing that kind of approach universally. We're seeing isolated programs, individual programs that help a few hundred here and a few hundred there and a few hundred here. But we're not seeing the large-scale programs that many of the panelists here believe need to happen in order to be able to make some movement. And so I am, again, very excited to hear what they have to say, to talk a little bit about the obstacles that they've had to overcome, to talk about some of the individual programs that some of them have going, like Mr. Salgado. And so what we'll do is I'll introduce each one of our wonderful panelists here. But before I do that, I want to let folks know that if you have any questions, please email events@clasp.org. So it's events, events, at clasp, clasp.org. And also follow along on Twitter at 2gen. That's at TWOGEN 2gen on Twitter. You know, and the great thing about this panel as well is that it represents folks working in different policy sectors that often work separately. Sometimes efforts are disjointed, and so we'll be able to hear from folks who work in workforce development, who obviously the mayor in government, post-secondary education specialists. So we'll be able to hear a diversity of thoughts on this. So I will introduce first Olivia Golden. She is the Executive Director of CLASP, the Center for Law and Social Policy. She's an expert in child and family programs at the federal, state, and local level. And she served as Commissioner for Children, Youth, and Families, and then later as the Assistant Secretary for Children and Families at the U.S. Department of Health and Human Services. She was also Director of the D.C. Children and Family Services Agency and the Director of Operations for New York. So she's had quite an extensive career in this field. Mayor Gray. Mr. Mayor has been leading the District of Columbia since November of 2010. He's a native Washingtonian, welcome, and has served the residents of the district for more than 30 years. He's focused much of his work on efforts to improve the lives of children and parents in Washington, D.C. He began his public service career in 1991 when he was the director of the Department of Human Services. So again, has a rich experience in this area. He continued his public service later as the council member for Ward 7, and 2 years later was elected to the citywide office of chairman of the council. and had served in that capacity until he was elected mayor. And Mr. Mayor will talk to us a lot about DC's early education programs. We have Dr. Donald Hernandez. And Dr. Hernandez is a professor of sociology at Hunter College and the Graduate Center at the City University of New York. His research focuses on historical and contemporary change in the lives of children and families, with particular attention to immigrants and public policy. And as a child of immigrants, I'm always very interested to hear what Dr. Hernandez's data is showing. He also has completed work on an alternative poverty measure for the U.S., and many of us that know about the poverty measure know that there are some issues related to it. And so he's working on a alternative poverty measure that overcomes many of the limitations of the current measure. He's also researching the extent to which socioeconomic disparities and cultural differences account for low enrollment in early education programs among Hispanic children in immigrant and native-born families. He's currently conducting research also on the disparities in child well-being by race, ethnicity, immigrant and socioeconomic status, and he'll be sharing with us his recent findings from some of his research. Dr. Gail Mellow. Welcome, Dr. Mellow. She's the president of LaGuardia Community College on Long Island City, Queens, since 2000. She's a member of the City University of New York system, and LaGuardia is nationally recognized among community colleges for achieving success educating underserved students. And she's had a strong voice for the role of community colleges in educating students for a global economy and for spurring job creation. So thank you so much, Dr. Mellow, for joining us. And lastly, we have Juan Salgado, and he's the president and CEO of the Instituto del Progreso Latino, and he's been there since 2001. His program is fascinating. When he first took over the program 13 years ago, they had a budget of $1 million, and in the last 13 years, they have grown to more than $20 million, to a budget of more than $20 million, and they serve more than 10,000 families, mostly adults, in the Chicago area. And so they've established, he's under Mr. Salgado, the Instituto has established national best practice educational and workforce, has become a model for best practices for education and workforce development. And the Instituto in 2009 was named by the National Council of La Raza the Affiliate of the Year. The Instituto recently has founded the Instituto Health Sciences Career Academy. That's a new charter high school aimed at helping Chicago's youth and helping them with their success in the growing healthcare field. So thank you, Mr. Salgado, as well, for joining us. How about I turn it over to each of the panelists, and they can give us a few opening remarks.
Okay, well, thank you very much. I'll begin. It's a great pleasure to be here today, to be able to talk with all of you. I'm going to be talking about results from new research which I conducted with Jeff Naparella, and which present the first ever data on child well-being across a broad range of domains as these outcomes are related to parents' education. This research follows up on our two earlier studies, which focused on disparities in well-being for children and families with different income levels and in various race, ethnic, and immigrant origin groups. To provide a consistent measure across as many children as possible, we studied 4 groups of children distinguished by mother's education levels, specifically not graduating from high school graduate with no college, some college, or a bachelor's degree or more. We calculated statistical indicators for 3 broad domains of well-being: children's family economic resources, children's education, and children's health. These data show that children whose parents have lower education levels are much more likely to experience negative outcomes than children whose parents have higher levels of education. I'll begin by noting that 1 of every 8 children in the U.S. lives with a mother who has not graduated from high school. That's 1 in 8. And another 1 in 4 children has a mother who has graduated from high school but has not gone to college. Turning to results, more than 1/2 of children live in poor families if their mothers have not graduated from high school. That's 53% poor among this group. This falls to 31%, which is still high for the high school graduate group, 18% for the some college group. Only 4% are poor if their mothers have completed a BA. But public policy discussion often focuses on a more comprehensive measure of low income, which includes both the poor and the near poor. That is, families with incomes falling below twice the official poverty threshold. If their mothers have not graduated from high school, an enormous 84% of children live in low-income families using this definition, nearly all. This drops to 60% and 40% for the middle education groups and to only 13% for children whose mothers have a bachelor's degree. Looking at actual dollar values available, the median family income for children with mothers not graduating from high school is $25,000 per year. This more than doubles to $57,000 or $67,000 a year for the two middle education groups and jumps enormously to $107,000 a year for mothers with a BA. Since most family income is from parents' work, it's not surprising that children with low parents' education often have parents who are not securely employed. That is, they do not work full-time year-round. Disparities in secure parental employment are very similar to disparities in the poverty rate. Limited parental education also has an impact on children's education. Data from the National Assessment of Progress show that only 16% of children in 8th grade are reading at grade level if their mothers have not graduated from high school. This climbs to 21, 36, and 49% for higher levels of mother's education. Math proficiency results are very similar to these results for reading. High-quality early education has been shown to have a large impact on later school success, but nearly 2/3 of children ages 3 to 4 are not enrolled in pre-kindergarten if their mothers have not graduated from high school, 63%. And the figure is only slightly lower at 57% if the mother has completed high school but no college. This falls to 46% and then to 36% for children with mothers completing some college or a BA. If their mothers are not high school graduates, regarding high school graduation, an enormous 40% of children do not graduate from high school, compared to 14 or 8% for children with the middle levels of mother's education. Only 2% do not graduate from high school if their mothers have a BA. Health indicators are also more negative for children in low-income families, for lower education families. For example, a large 29% of children are not in very good or excellent health if their mothers have not completed high school, compared to 20 and 16% for the two middle levels of mother's education, and only 8% if their mothers have a BA. Disparities in death rates are also very large. For example, the infant mortality rate for children with mothers not graduating from high school is 8.2 deaths per 1,000 births, which is more than twice the rate of 3.9 experienced by mothers completing a BA. We also find very large differences in obesity and health insurance coverage. These national trends mirror trends within specific states in the District of Columbia. For example, in Illinois, New York, and Washington, D.C., states represented on this panel, 1 in 7 children live with mothers who have not graduated from high school. Among these children, the poverty rates are 45, 53, and 52%, respectively, and the rates of not having a securely employed parent in the home are 44, 48, and 53%. In addition, between 84 and 89% are below grade level in their reading proficiency, and 85 to 87% are below grade level in their mathematics proficiency. In fact, among children who have not graduated from high school, the poverty rate in every state in the U.S. is at least 32%, and the rate of not having a securely employed parent is also 33%, while the rates of reading and mathematics proficiency below grade level are 75% or more. Policies and programs aimed at increasing educational and economic outcomes typically target either low-income children or their parents, but not both, which limits their impact in fostering intergenerational mobility. This insight undergirds the development and implementation of two-generation or dual-generation programs. The data that I presented and additional results in the Foundation for Child Development's report highlight the need for dual-generation strategies that offer high-quality early education and care, combined with effective education and job training for parents that lead directly to well-paid work, as well as the need for wraparound public services such as health, mental health, nutrition, food, and housing, which are needed for low-income families to overcome barriers to success. Thank you very much.
Thank you. So this is a first time I'm on a panel where I'm sitting in the middle of two doctors, so I'm feeling the love, and one Latino doctor, so I'm being inspired too, right? Which is great. I didn't quite expect it. So we're in a working poor community, Latino community in Chicago. Average family size 3.6. Average annual income of our participants $17,000 per year. Every participant, almost every participant in our organization has less than a high school diploma. And we have a base belief that education is the power and freedom to live and enjoy the best that this country has to offer, the power to provide for our families and ensure a better quality of life. And we open our facilities 6 a.m., we close our facilities 10 p.m., and it's intergenerational day and night. We have a theme, it's called Register the Student, Enroll the Family, and you're going to hear a little bit more about that. And we partner with a wide range of institutions to craft solutions that meet the needs of families. So we've had to become adept at learning how to operate with so many separate and disparate systems to deliver for the family in a seamless way for them. Let me give you an example. We're a workforce provider through the Workforce Investment Act. We're an adult education provider through the College Board. We're a testing site for elementary and secondary education through the Mexican government so that people can earn their primary and secondary certificates. We're a Bureau of Immigration Appeals accredited organization, right? Through Citizenship Immigration Service. We run 2 charter high schools, one for kids that dropped out and another one you heard that's health sciences oriented, right? And there's a few other things, right, that we're doing, but we're after family well-being is what we're after, and these are just means to get there. Let me give you an idea of how this works for families, right? We have a Careers in Health initiative where we've turned 4th and 6th grade limited English speakers into licensed practical nurses and registered nurses. 400 have completed. 80% of those who have started actually completed. They're now making $23 to $27 per hour from what used to be minimum wage to no wage at all, right? So it takes 2 years with us to get them college ready with no remediation required, and a year or so with our partner community colleges where they get their actual LPN. When they're with us, they're 5 days a week, 4 hours a night, 6 p.m. to 10 p.m., study on the weekends. They're full-time work, full-time parent, full-time school, right? Because they're basically doing their high school as adults, right? And so we help make life work for them during those 3 intensive years. We enroll the family in early education as young as 3, youth development as well, all the way to the teen years, beginning at 2:30, ending at 10 p.m. We have a partnership with the Greater Chicago Food Depository. We have a kids cafe, so the kids get healthy meals. So literally, you got a kid coming from school, you got a parent coming from work, you got a parent picking up their kid and coming together, and they don't have to worry about eating because they have to worry about studying. So we have to make sure that our students are ready to learn and their kids are ready to grow. And so 3 years of tough sacrifice with the proper support to get ahead, people will stay ahead, right? And that's what we're talking about. How do we get people to stay ahead? So let me tell you a quick story, okay? Lourdes Bravo Morales, mother of 4 boys. Oldest boy was being kicked out of neighborhood school where the counselor referred the family to us, right? So we registered her son, Jeremiah, in our school, which we have 250 kids that are formerly out-of-school youth, ages 16 to 21. Almost half of them are mothers and fathers themselves, with student-to-counselor ratio of 30 to 1, a teacher-to-student ratio of 20 to 1, a partnership with the Adler School of Professional Psychology, with psychologists in the building to make sure that our kids can properly deal with toxic stress that comes from violence, that comes from parenting, that comes from just their lives, which are different than our lives. So Lourdes, the mom, right, comes because her son came to our school, and she says, man, I want to be a healthcare professional. So she registers in our nursing program that I told you about a few whiles ago. So guess what happened in the spring of 2013? Lourdes earns her certified nursing assistant, right? She's out working. Jeremiah graduates from high school. He's now going to Harold Washington College. His younger brother, who also wasn't doing so good in school, is in our school. He'll be graduating next year. And the 2 other brothers who, if there weren't a family intervention, would probably end up in the same path. 4 boys on the street, right? No, 4 boys finishing college, and a mom headed on a career, right? And so this is the living example. By the way, the niece is in an after-school program too, right? Because it's not just about the immediate family. There's like other family members, right? So when you take this approach, you know, you can get some pretty interesting results. So, but let me tell you, you know, this get to the policy. We want to talk about the policy, but behind all this is a compliance operation and an accounting nightmare, okay? Audits from every direction all the time, always looking for a gotcha. Never believing we could weave it all together and still follow all the rules. Exposure, you have to manage. Risk like you don't believe. Be creative, be entrepreneurial, integrate, work together, make it seamless for families, but follow the rules and follow the rules at all times. Consequently, guess what, folks? It does not get done very often, does not get done very well, it certainly is not efficient, and in the end, organizations either can't build the capabilities, they don't have the will, the enormous will required, or they simply don't want the risk exposure. And so, folks, we don't get it. And if we don't get it, families don't get it. That's our current state. That's our current reality. Thank you.
So I've already told Juan I have to go. I have to see this in action. So I'm president of LaGuardia Community College. We have about 65,000 students in New York City. 2/3 of them were not born in the United States. They come from 162 different countries. And community colleges, my community colleges and others, really, I think, understand the power of thinking of the people we need to educate as families of people. The average age of a student at a community college is 27 years old. More than half of those folks have kids. 2/3 of them are working full-time. It's sort of the same kind of family complexion that Juan just talked about. But this is in every legislative district in the country. There are 1,132 of these. I just got to pass the Community College of DC, UDC, right down here. I got really excited, yes. But we do not treat these incredibly, more than half of all undergraduates in the United States go to a community college. They're more likely to be women, they're much more likely to be poor, and they're much more likely to be people of color, particularly Black and Latino. And yet we fund these institutions less than we fund elementary schools. So one of the challenges, and Juan talked about the challenge of thinking of it as a system, and I also think we have to think of systems of funding. So why would we even want to think about families at a college? Well, it's essential. It's essential that we do that. Let me start out with workforce development. When we do workforce development for immigrant families, we teach them, as Juan talked about, well, very basic certified nurse assistant or green waste management. They're sort of very specific things that people who have limited literacy, often in their home language, and for my students in English, can learn. But we teach them by contextualizing that in how do you talk to your kid's teacher? What are your rights as a family? If you work for somebody, even under the table, they still have to pay you. There are very basic things that people need to know in order to connect with a workforce and move forward, to move themselves out of poverty. When you look at what can happen when you connect a GED, or you're not allowed to call it that anymore, a high school equivalency with a college, because as Don talked about, a high school diploma is extraordinarily important for people who don't have one. And if you've ever gone to a graduation, you know that people are so proud. And you have to say, but it's not enough. And Juan said, you have to go on for that CNA and then hopefully for your LPN and really move ahead if your family's going to survive. But we don't set up our systems of education as if they have to integrate. We never think about the issues of immigration, ESL, GED, and employment as a system. They're all very separate in our country. And what I deal with as a college president is the real desire to move students through who are families. But if a family member, let's say a dad, goes through our GED program and wants to apply to go to LaGuardia Community College, and he's poor, right? So he should get financial aid. But if he has children, the amount of money we give him for childcare is subtracted from the total amount of aid. Our financial aid policies are punitive towards parents if you want to give them the support they need. We never think about childcare as being a basic function of a college. But if families are going to go to work, not only do we need childcare for the little kids, but as you heard, Juan, I don't know if you really thought about it, Juan's talking about evening, right? That's when most working parents, and most poor parents are working, are going to go to college. We need older children care as well. You need 10, 11, 12-year-old kids because you don't want them at home. None of our policies really integrate our ability to think about that. I'll tell you another thing that drives me crazy as a college president, and that is that almost all of the workforce development work that we do, whether we're training, again, these are entry-level jobs, how to go into Duane Reade, which is a New York City-based pharmacy chain, and stock, how you need to read in order to stock, how you have to go through and really think about what's happening in green waste management or cabling. There is no sense that you're a family member. There is no sense that you might really think about a larger, like, when do we offer these activities? How do we pay for them? Is the fact that you're a parent ever included? It never is. So I'll end with these are mostly women, but I happen to have two male stories. So it just happens that Jesus was a single father in the Bronx, not going anywhere, and he came to the LaGuardia Fathers Academy, and you have to be interviewed to get in, and at the very end of this, it's a program where you get a GED and hopefully then move on to college. At the very end, his counselor said, well, does this sound like the right program for you? And this 18-year-old young man said, it's more than exceeded my expectations. And so the counselor said, well, how so? He said, this is the first time an adult male has ever talked to me for so long. So when you think about the family deficits and what we need to do as a society to allow for education, you've got to think of Jesus and the thousands and thousands of kids who are dropping out of high school, who don't know where to turn, and who really need education to be family-friendly to move everyone forward. Thank you.
Thank you very much. I'm delighted to be here. I represent the great state of New Columbia. One day to be the 51st state. What a great place this is. This used to be a warehouse, for those of you who don't know, and it's been converted into a phenomenal building by NPR. And what's especially exciting for me is I actually grew up in this neighborhood. I grew up about 6 blocks from here, and trust me, it was the hood when I was growing up. It has really started to convert now, and it's a source of great pride for me to be able to see what's happening here and across our city and to be a part of this. When I got the invitation to participate in this, what motivated me most was the opportunity to see my longtime friend Olivia Golden, who I had not seen in quite a while. So I said, I'll participate in this because it is an opportunity to talk about an important policy issue, but also to be with someone for whom I have just absolutely enormous respect and have enjoyed working with over a period of years. I want you to know, Dr. Hernandez, that last night I sat down to sort of, thumb through your research, and I got so wrapped in it that I read the whole study. And it's some compelling data, and I would invite all of you who haven't done that to sit down and read it, because the data are compelling and the conclusions are they make absolute sense and probably I don't think there's anything in there that anybody would disagree with, but we simply don't take the time to pay attention to it in the ways that we should. One of the things that, my background is in health and human services for the most part, and I got into political life rather late. I got into political life in 2005 when I became a city council member, and then 2 years later became the chairman of the council. And I recognize in the short shelf life that you have in these jobs, you better take full advantage of the policy opportunities that are before you. When I became chair, the then mayor made a proposal, which I was happy to help usher through the council, to create what we call education reform in the District of Columbia. And that was focused on the K through 12 grades. And we ultimately approved the policy, which included the mayor having control of how the public education system is run in the city, which is really still, even today, several years later, unlike most jurisdictions in America. It gave me also the opportunity to raise a question that I still don't have an answer to, and that is, why is it that children start school at 5 years of age? You know, we've had, you know, early childhood education programs of one sort or another in this city for a long time, and most other cities have. But why is there an expectation that a child doesn't start school until she or he is 5 years of age? In fact, one of the things that is amazing to me is that we continue to use the term preschool. And so I set out as chair of the council to do something that I thought would be different. And there were a few advocates who worked with me in the community, and that was to be able to organize a system of early childhood education very differently than what we've had before, and to be able to create universal pre-kindergarten, and that is to be able to have an organized place for every 3- and 4-year-old in the District of Columbia. And I was able to get the legislation through. We said that we would accomplish this by 2014. This would be 2014. I guess we have until the end of the year to be able to get there. But we have made an enormous progress. In addition to creating access, we also set out to do some other things as well that really are more within the purview of quality. One is to make sure that children were ready for the kindergarten, and we've now been working with 9 other states to be able to create an instrument that would do a better job of determining whether children are educationally and socially ready to be able to move into kindergarten. We would, by creating such a system, we also would be able to enable parents to work, and you've heard some discussion about workforce development and getting parents more in touch with opportunities to work, that they would be in a comfort zone knowing that their children are well cared for, and that we would have the opportunity to create a sustainable future for their children. Where are we today? We just got the NIEER report. Even as mayor, I get to read all of this stuff, Olivia. It keeps you sane. We just got the early education report from Rutgers University. We now have an all-day school, and we call it school because our young children go to public education. They go to either charter schools or DC public schools. We have 94% of our children who go to school all day, 4-year-olds who go to school all day, every day. And we now have 80% of our 3-year-olds who go to school all day, every day. What we now are focusing on is working to improve quality. I see the time went up, so I'll try to summarize this. We're working a lot on quality at this stage. We've created something called the Early Success Framework, in which we are bringing agencies together, because we all know that every agency works very hard, but oftentimes they don't work with the people who are around the corner, down the street, or doing similar work to them that would enable us to do an even better job. So the Early Success Framework and the Early Success Council includes 10 agencies. It includes our education agencies. It includes our employment agencies. And in the education agency, it includes the community college as well. And it also includes our health and human services agencies like the Department of Human Services, the Department of Behavioral Health, and the Department of Health. In the legislation, we have embedded a number of things that we are now, and this is probably never ending, and that is standards for teacher qualifications so that we are increasingly raising the bar for those who work with our very young children, a requirement for family engagement, bringing funding schemes together. We have now blended the Healthy Start money that we get with our own funding approaches and taking advantage of Medicaid approaches. If you want to have a real eye-glazing opportunity, sit down and try to understand Medicaid, especially things like the EPSDT program, Early Periodic Screening, Diagnosis, and Treatment component, which is a great avenue for being able to provide funding for very young children. So I'm going to stop there. We'll have a chance to talk further about this during the Q&A, and I would love to do that. So thank you very much.
Well, it's wonderful to be here with this amazing group of people and these extraordinary panelists. I actually, also, one of the reasons I'm most excited is the chance to be on a panel with a mayor who I knew first when he was doing the kind of work that Juan is doing now as a leader of an exemplary community program. And it's just, this is just an amazing group on a crucial topic. My role in this panel is to talk about state and national policy. So I'm supposed to be the representative of all the irritating people who create the rules that drive everybody nuts and explain to you why that matters so much. And I want to really make 3 points in the course of my short opening remarks. The first is that you have to focus on improving quality because the scale of what we have to get done, of the problem, and therefore of the solutions, is so large. The second point is that I actually think there are a lot of policy areas where there are right now big opportunities to improve what we do in a two-generational way. And the third is that when you think about how to make policy better, there are plenty of doable next steps. You've actually heard from everybody, particularly the mayor in his last remarks, about ways of doing it. But they're not simple. There's not any simple, grand, let's wave away all the problems and come to a solution. And if anyone suggests a simple answer, it's probably wrong. So let me go back and make those 3 points. So the first one, we have to focus on policy because the scale of the challenges is so big and we have to move fast. You heard a lot of the numbers. I just want to underline the ones that to me are most stark. Poor, about 22% of children are poor, about a quarter of young children who are at their most vulnerable. And if you add in those near poor families that Don was talking about who are just struggling to get by a little over the poverty level, you come up with more than 40% of children, about half of young children in the whole country. So we're not talking just about a small number or an isolated group who we should worry about their futures. We're talking about a lot of kids. So the second theme is that, yes, that's a big challenge, but there are actually a lot of policy areas where there's a chance to make a large-scale difference. And I'm going to come back to the one we've been hearing most about in this conversation, which is opportunities to connect parents, education, training, career readiness with young children's or older children's high-quality care and education. But I want to name a couple of others. We can come back to them in the Q&A. One big one, which the mayor briefly alluded to in talking about Medicaid, is health and mental health policy. In the United States, we've done a pretty decent job in the last couple decades of connecting children to health care, but we've done a very bad job of connecting parents until the passage of the Affordable Care Act. So now we have a chance for adults also, including parents, to get health and mental health treatment. The reason that's too generational is that getting help for a medical problem or a mental health problem enables a parent to move forward in their own education or training or career, but it also makes a huge difference to young children's readiness because the research shows consistently
that when parents get treatment, for example, for depression or other mental health problems, that means that their children have a much better chance. The parenting is better and the children's outcomes are better. Third area I just want to mention is labor policy, policy about low-wage work, because I think Gail said this. In the workplace, no one understands how many workers in low-wage jobs are parents, and so issues like the absence of being able to get any paid leave or completely rigid schedules, again, make it impossible to support two-generational outcomes. And I'm just going to mention, we have a lot of people from DCPS in the room. The mayor mentioned K through 12 as an arena that, in fact, serves some parents in the older grades and lots of kids. And I want to highlight Head Start and Early Head Start, founded as two-generational programs, and again, an opportunity to build on the institutions that exist and expand their reach. So my third point is that within any of these areas, whichever one you pick, there are important opportunities to make policy better, but they're not simple. You basically have to work at the same time on 5 or 6 different dimensions. You have to address financing. That's partly the issue about blending, but it's also, do the dollars go to in the right way? So do child care subsidies actually help kids stay in a program for a year or 2 years that can help their development and their parents' work, or do rules make kids go in and out? You have to pay attention to incentives and outcomes. When the federal policy or the state policy tells Juan if he's doing a good job, do they understand that it's going to take 3 years to move through for people who start with low skills or with family obligations, or do they count that as a failure? You have to pay attention to the way the policy supports quality and staff training. It may be hard enough to get early childhood programs to be good for kids. If you also want attention to parents and their needs, how do you support that? You have to pay attention to the total budgets. I think several people have said this, because if your programs, your workforce dollars or your child care dollars are so skimpy compared to the need that serving two-generationally means leaving out other really important groups of people, that's hard to do. And finally, you have to pay attention to alignment, and that was Gail's point about how, for example, can student financial aid and other supports fit together. And we actually think there may be some good solutions on that one, Gail, so we'll follow up. CLASP has done a lot of work on the specific opportunities. In the child care world, new regulations, new policy, opportunities under existing policy. In the workforce world, we've done lots of work on opportunities today, career pathway strategies, and I think at this moment, as we're talking, the House may be voting on a new workforce reauthorization, which would improve some of the incentives, deal with some of those issues, and on the community college and public program side. So I guess what I want to highlight is there are many important practical things to do to make this better, and if anyone in the room wants to do them, we at CLASP want to help. Thank you.
Wow. So thank you all. That was fascinating. You know, one of the things that struck me the entire time everyone was talking and giving us the data and telling us about the examples, and Olivia just now basically laying out the blueprint of how to get this done. And I kept thinking, why hasn't it been done? What's the issue? Because we have Juan and Dr. Mellow and the mayor. They've given us examples of successes. Dr. Hernandez has given us the numbers, and Olivia pretty much has kind of laid out, like, here you go, here's the plan. Maybe all of you can talk a little bit more about what's the obstacle? Why isn't this happening here?
I can start if people want that. I mean, because I would highlight a couple of things. I would say it is not just our policies that don't support families two-generationally. It's also the way our private sector is organized, the labor market and many aspects of the private sector. So we haven't come to terms with the fact, I just looked up this number for another speech, almost 60% of mothers are in the labor force with a baby less than a year old. There's no way that we have, in Duane Reade, in the drugstore chain, in the health world, in the CNA, and anywhere, that we've developed policies about work schedules or leave that accommodate that. So it's much bigger than just programs. The second thing I would say is that in many cases, the political climate and context around how we think about parents in particular is pretty complicated. It's not accident that we took a long time to fund health care for parents, that we don't necessarily fund workforce training programs at a high level. It's a big debate in the United States about the extent to which we should be investing in low-skilled parents. And the last thing I would say is that I think it's complicated and hard just because each of these worlds is complex in itself. The mayor was talking about you could go to sleep studying Medicaid, you could go to sleep studying the Workforce Investment Act or the child care subsidy policies. So it's not that people are bad people when they don't fit them together, it's that there's tons of hard work to be done, and you have to do that work to get, you have to see it as urgent to get to the next step.
If I might, I would also say that we still have pretty much 19th century ideas about what education should be in a 21st century world. So Mayor Gray talked about why 5? Well, it was probably because up until 5, the mom could like work in the field. You know, it's sort of like, it really, they're so ancient, these traditions. College was for 2% of the population, mostly if your parents were already rich. I mean, it's just sort of like school was what you did, and you walked to it, and it was safe, and you didn't have to worry about what was happening with your kids between school and home. So in all of those ways, we have not come to grips with, we're a 21st century knowledge world, that education is absolutely essential, and that we have millions of people in the United States who need to be educated who are adults. So that doesn't even fit into our idea of who should be going to school, a 35-year-old, and yet that's exactly who needs to be going to school. So I think we have to really, I always say it's let go of the Woody. Most of the people in this room are like 50 years younger than me, but Woody was a station wagon, and it had wood on the sides. And I think of mothers bringing their kids to college in the Woody, right? Today's average college student is a mother who is working with children. That's a modal. So that we've got to really rethink all of these systems, and I would agree with Olivia that it's complex to do that, but I guess we're saying here that it's necessary.
How do you prioritize, though, given that it is complex? How do you prioritize, get folks' attention? How do you, given also the budget constraints, what do you do?
Well, I don't know if the mayor was going to answer that one. I have an answer, but I don't want to hog the question. Well, I would say you prioritize in a couple ways. You pick where you're doing the most damage. So if you have rules right now that are preventing workforce programs from, or community colleges from addressing the needs of people, because we're saying everything has to be quick and easy, and it's not. You prioritize based on where there are the biggest opportunities. That's why healthcare is on my list. We've already passed the Affordable Care Act. We already have a huge funding stream that, if states make the right policy decisions, they can use to help parents as well as kids. And then I think you prioritize for local opportunities. The mayor said you seize the chance you've got, and then you try to build on those to get to something bigger next.
You know, the age-old question for so many, too, is how do you take, for example, the work, like Dr. Hernandez shared with us earlier, and see that, see the light of day in some kind of applied fashion. There's not a person in this room would argue with the findings that he shared with us today. But how many of us will leave this room today and go do something that will actually make a difference in terms of policy and programs in whatever, wherever we work and whatever, jurisdictions we work in. Early childhood education to me is a great example. I don't think anybody would argue with the preventive power of early childhood education. Yet, when there are funding cuts, and you raised the question about funding constraints and priorities and that sort of thing, I have watched early childhood education be cut across, especially during the recession. It was some of the first programs that were cut, and some of the worst decisions were made. And some of that is driven by the fact that so many jurisdictions operate under court mandates or legal mandates that they have to comply with. And there is no legal mandate for early childhood education in any jurisdiction, so it's one of the easy things to cut. You know, I mentioned that 80% of our 3-year-olds now are in all-day education programs. The next state, because we're compared to a state for these purposes, the next state was at 21%, which means that nowhere other than the District of Columbia do we have more than 1 out of every 5 children at 3 years of age who actually go to school. That is a horrible lost opportunity, ladies and gentlemen, and we'll sit in a room like this and continue to have this discussion, and yet we'll be able to go back and visit the data 3, 5 years from now and probably have, unfortunately, situations that aren't much different than that. So, to me, the priorities have to be established in terms of focusing on the earliest possible intervention that you can make. And then getting some folks to sit in a room and figure out how you make these funding schemes work. How do you bring Medicaid dollars together with Head Start dollars? One of the things I did, and I'll stop on this, but one of the things I did, because I was afraid when we did the law around universal pre-K, because people won't argue with the law. You just never get it done because there's no funding. What we did was we incorporated it into our uniform per student funding formula so that it is funded in the same way that 7-year-olds, 9-year-olds, 11-year-olds, and 14-year-olds are funded at whatever the cost is. So it is a part of our funding formula, and it will be extremely difficult to effectuate any cuts without effectuating cuts in other parts of education. And that's one of the policy approaches that has to be used, because otherwise, with no mandate, you will find in tough times it's one of the first things to go.
I think I'd like to add one perspective that I think could add value to the policy world, and that is organizing, right? And student movement, right? So, and I think, you know, going to Dr. Mellow's point, right now there is, you know, there is some student movement around the cost of higher education, right? But it's the traditional student looking at the traditional situation in higher ed and figuring out how do we get the cost of higher ed down in that traditional setting. It's not that student that Dr. Mellow's talking about, or many of the students that I'm working at that are the adult students, and yet in that universe of dollars, right, as we have an open bank for the rising cost of higher ed, there's probably money to support the families. There's probably money to support the kids, right? But we need to organize, and those two groups need to see their common self-interest, right, in bringing that system into some more sensibility, right, and efficiency and good return on investment.
I just want to add too, and I think the mayor and Juan's amazing institute are examples. It can start very locally. I mean, the mayor has a big local, but you started from probably a small building and an idea. Right? And it really, you can put one foot in front of the other if you think differently, if you think collectively, if you understand that all of these systems together are very powerful. So I would encourage you to take small steps forward, and I really think you can build larger coalition, and then maybe run for the mayor at some point.
I might just add and highlight that the federal government is potentially critically important in this, as well as the local areas. The federal funding sources that touch on all of the areas we've been talking about: Head Start and Early Head Start, the Child Care Development Fund, Workforce Investment Act, the Higher Education Act, TANF, SNAP, food stamps, WIC. The Administration for Children and Families is developing an initiative around assets for families and the development of assets. To the extent that these can be blended and brought together or braided, as the mayor is doing, there's an enormous amount of resources available already to try to move in this direction, to really focus on both children and parents within the same families. The state and local governments also are critically important to this. It's possible to create state and local policy structures that are flexible in a way that allows these federal funds, which flow through the states usually, to be brought to bear for the kind of two-generation programs that we're thinking about. There are some states like Florida, Michigan, Texas, Utah, Washington State that have these kinds of structures in place and which are potentially available to move forward with this. So if you're in one of those states, look to those policy structures and think about working with them. And if you're elsewhere, take a look at those states to see what sorts of structures would really facilitate and could facilitate bringing these large federal funds to bear. At the local and state level, obviously, states and localities are spending large amounts of money on school, on elementary education, on pre-kindergarten, on some workforce development programs. To the extent that these can be integrated and brought together, it takes a lot of small steps, as other panelists have suggested, to do that. But people who are out in those localities and those states are in a position to be able to do that.
You know, oh, I'm sorry, go ahead.
I was just going to add to that, that one of the things that we do at CLASP and others in national policy organizations do is try to help make that bridge by knowing the people on this panel and others who are doing really interesting things, finding out where they come up against a barrier, because often you come up against it, you don't know if it was a state policy decision, a federal policy decision, some quirk of history that nobody ever really decided, it just happened that way. And so part of what we try to do is understand both sides and offer up the ideas. And so part of why we think there are now lots of opportunities is that, as Don said, there's a lot of federal interest on the child care side, on the child care early Head Start partnerships, on the workforce side, on the health side. And so there's a possibility of taking problems, getting them solved, and then trying to spread them. But the one catch that I want to highlight, since we have such a broad webcast, is that in the end, the federal policy solutions have to make a difference, not just in the district, New York and Illinois, which are all states with and jurisdictions with a tradition of considerable public investment in these families, but also in the places that have the largest and growing number of poor kids, in Texas, in Georgia, in Florida, in the South and Southwest, which are places with less of a history of fiscal investment. And so you have to figure out both.
Well, and Mr. Salgado and Mr. Mayor, I'm curious, piggybacking on this idea, you both have had experience in bringing people together in the same room and breaking down the silos, building collaboration. Maybe you both can talk to us a little bit about how you did that, because you're doing it from different perspectives.
Well, I did it using my office as a bully pulpit. I tried to organize our system when I came into office, frankly having had some experience with this, in a way that would put in place people who are deputy mayors, those positions that existed a while ago and they were eliminated, the deputy mayor for health and human services in particular. And the role of the person who was in that job, who happened to be somebody who had worked a very long time in the private sector, had all the scars to show for trying to make these things work. The role of that person was to bring these agencies together in the same room, and then for us to create outcomes and incentives that didn't simply reward an agency for doing its work, that rewarded outcomes that were group outcomes, that the payoff really resulted in agencies X, Y, and Z working effectively together. A good example for us was TANF reform, which the District of Columbia, and I think it was benevolent, chose never to implement it in the way it was required at the federal level. What happened was, as we know, I was 1996, 1997, when TANF came along. It said that after 5 years you are out in terms of being able to continue to be subsidized. The District of Columbia chose never to do that. And the way it handled it was, it said after 5 years, we'll just pick up the tab. We'll continue to pay for people. We know we won't get any federal dollars for them. And it was extremely expensive, and I think it created an environment within which we became enablers. And frankly, it wasn't until we got the workforce development people in the same room, that we got the human services and health people in the same room, kind of organized systematically with the deputy mayor running those agencies, not directly, but coordinating those agencies, that we started to change the policy. And frankly, in 1996, it wasn't until 2.5 years ago that we actually changed the policy in the District of Columbia and created both incentives and disincentives, trying to help people see that they needed to move in a different direction. They needed to have a different way of life if they really wanted to be self-sufficient, because whatever check they were getting each month, it wasn't doing anything but simply creating further dependency on the part of the people who were in those circumstances. For us, frankly, it was a matter of bringing agencies together who were forced to work together. And, you know, part of the incentive was the payoffs that came with those agencies, but also the disincentive was, if you don't want to do this, you're going to have to get a job somewhere else, because that's the way we operate here.
Juan, you don't have the same bully pulpit.
No,
but how did you
I
do
don't
it?
have the same bully pulpit, but the mayor's earned his. You got to have people behind you, right? And he's got bully pulpit because people voted for him, because he earned the opportunity to have that bully pulpit. And I think, you know, even though we may not be mayors, we can earn that opportunity to have people behind us, right? By the work that we do. For 10 years, actually, I was the chairman of the Illinois Coalition for Immigrant Refugee Rights, worked to organize on a volunteer basis 130 institutions that worked across the state of Illinois. But in my day job, right, was running this institution. And quite frankly, I think some of the change that happened, some of the visibility that we were able to provide on the work that we're doing was a combination of both, you know, decision makers understanding that we had some power, right? And also the reality that we had immense power, you know, not just because we had people behind, but because we had a product that works, okay? And so, and the diversity of the people behind you. So I'll share this Careers in Health initiative, which started many years ago. It's part of a national study. But I sat in a room when our colleges weren't anywhere near what LaGuardia is, right? Where our colleges have been on a, you know, our community college has a 7%, had a 7% completion rate. Okay, so if you sent these students to community college, they weren't coming out. Okay, we're now, I think, up to like 17 or 18. It's getting a lot better, you know. But at the time, I had healthcare leaders that were supporting this program, healthcare leaders that subsequently supported the creation of a new charter high school to get more people. I had those leaders at a table pointing to me, pointing to the chairman of the colleges, pointing to the chancellor of the colleges, saying, how can this little organization with this little budget get this done and you can't do it? What's the matter here, right? And so immense pressure. Now, you know, they were our partners, so I'm a little comfortable, right? Because I'm sending them people, right? But you know, we've got local leaders behind us and we've got business leaders behind us. And you've got a really good product, and people can't turn away from results. They have to go towards results. So if we are getting results, then don't lose the opportunity to organize, right? Because that's your window to change things. And that's what I would say, you know, and you've earned it. By your results, you've earned that opportunity.
And I would just add, we've been talking a lot about government, but you mentioned private business, and I will say that it's really essential that we work across the public-private line as well. So when I do work, for example, again, I do nothing. I'm a college president. I sit in my office. I eat chocolate all day. The faculty and staff do all the real work. But when they do these amazing things, like with Accenture, which is this very big company worldwide, and what we figure out is that, you know, even a fancy place like Accenture needs a whole range of people who are going to work there. They have a stake in the ground for making this work. And so when you find ways to bring them to the table and introduce them to the extraordinary people and the hardworking people that we all serve, there is a new openness, I think, to understanding that, and an ability to think about, well, what really is necessary to come in? And I mean, we worked with something called Fresh Direct, which delivers groceries in New York City. And we found that the drivers, and again, because it's New York, many of them were not born in the United States, were making inaccurate deliveries because they couldn't read the map well. Well, you have to give them education, but it has to be connected to their work. So this issue of contextualization is really important. But then they can't come at 6 o'clock in the morning because the child care centers don't open up at that time. So if you bring businesses in, they begin to see the interconnectedness of all of these social supports, but they have a stake in it because they need employees who are really educated and can help move their companies forward. So I think bringing people together, we've got to make sure that the private sector is in on this with us.
I'm curious, one of the things that as you all are discussing this, that I should have asked you maybe a little bit earlier, but I'd like to talk, and maybe Dr. Hernandez can start us off on this, is why we're having this issue, why children of less educated mothers do worse. And piggybacking a little bit on some of what folks are saying, it raised the question about, is this about family income? Is this about poverty? What is the role of parenting and individual responsibility? I mean, a lot of those conversations are happening nationally, very in a somewhat polarized political environment, but I'd like to hear your thoughts on sort of one and the other.
Sure. Well, I think it's sort of all of the above. Parents who are not able to get a good education when they were children, and it's this cycle you alluded to earlier. The problem we have with a lack of intergenerational mobility in this country, a lack of opportunity, educational opportunity for poor families, for families that have parents with limited education. This is a problem that's been continuing for decades. In some ways, it's getting worse. So it's kind of a chicken and egg issue here. If we start, let's say, with children who are not becoming well educated because they're in poor schools, because they're not in high quality early education, because they're not learning to read and write when they should be learning, they ultimately become parents and adults who are not in a position to earn good incomes, well-paid jobs, to follow a real career path, to find full-time employment as well. And so these parents often were not themselves successful in school particularly, and they're not necessarily well positioned to help their children, although there are things certainly we can talk about that parents can do. There are various ways that parents of any education level can be engaged and are engaged with their children. But because they also because their incomes are also limited, they're not in a position to provide the kinds of advantages that higher income families have for their children, access to books, to field trips, to the kinds of stimulation that would help their children, and also, particularly importantly, to high quality schools. We know how schools are funded in this country, mainly at the local level. That's why I often think about the federal level as providing supplements and to increase the equity that we have across localities and states. But they often, these children and their own children later go to low quality schools. And so we need to think about how to improve those schools. And we need to begin at the beginning. Education starts at age 3 in Washington, D.C. Thank you very much, Mayor. That's terrific. That's very exciting to be able to accomplish that in the District of Columbia. So I'd say it's all of these things. It's parents' education, it's a lack of income, and then again, it's the policy structures. Governments have a responsibility. The government represents us. The government isn't sort of out there somewhere. At least they shouldn't be. They represent us. There are elected officials. There are people who are appointed to agencies by our elected officials, and they should represent people, all the people. And a large number of people, as we see, a large number of children face very difficult circumstances and deserve the opportunity in America to get a decent education, to become well educated, and to have the opportunity to make a good middle-class income.
I would also want to say all of the above, but add a couple of things. The research evidence about why kids in low-income families do worse sort of highlights a whole range of reasons, right? One is about the circumstances of poverty itself and living in poor and sometimes distressed and violent neighborhoods, not enough access to food, the stress that comes in eviction, uncertainty in your life. Part of it is by way of parents education we've talked about, but also the experiences that parents have as a result of poverty and low-wage work, the stress in their lives, the challenges that puts on parenting. So, and then health and mental health issues that are often very prevalent in both generations. So I agree that all of the above is a powerful answer. I think it is important to note that we have to deal with this in the United States more than we did in past decades because the share of children growing up in those circumstances is really big. I said to you, more than 40% of kids, half of young kids in families that are poor or near poor. And that's partly because of changing demographics of who's having kids, and it's partly about the ways in which the economy isn't working as well for a set of people. But then you get to the individual responsibility and the how do you tell this story in a political environment point, and I just want to say a couple things, and I know others have a lot of experience. I always talk about a couple things. One is, the children are our future, so whatever your perspective on whether a parent should have had a child before she finished all of her schooling, those kids, I mean, that's half of our future labor force. Those kids are our future. But the second thing I always talk about is the ways in which parents who are trying really hard to do the right thing get tripped up by everything we're talking about. So somebody who's trying to work full-time in pick your job in a retail setting and has her hours constantly changed and can't possibly do what she wants to do as a parent or find her kid a stable place to be in early education. She can't, if she goes back to school, she's not going to be able to figure out how to also work. She's not going to find a job that will accommodate her hours unless she finds the way Juan is putting the pieces together for her. She wants to do the responsible thing and get treatment for a health problem that's preventing her from working regularly. She can't get insurance in half the states. She can't see a doctor. So I think of it as the people who are trying the hardest are ones that our public policy puts obstacles in front of. And the last thing, and I can come back to this, I actually think that one of the ways to learn about how to move ahead in a difficult political environment, I think one lesson is results, which is the point that Juan was making. The other, when I work with people in states all over the country, I'm always interested that their answers are sort of different. In Idaho, where they're really conscious of the issues posed by low-wage work, we're working with them on making their child care system work better, and they actually care a lot about what could enable somebody to move up, even though, you know, their constraints on dollars are big. South Carolina is very focused on young children's health. So sometimes the lever that lets you get into this conversation is going to be different in different places.
Wonderful.
On the message, I would just add one thing, which I think unfortunately gets lost, is the value that these workers are providing today, right? And so, I mean, their contributions are already being devalued by the wages, by the working conditions, you know, by all of those things. And I think we've got to get through that, right? We've got to really, you know, continue to impress upon society the immense value, right? You know, we'd say in the immigrant rights movement, you know, bless the food that you had today, because, you know, if you had any vegetables, they were picked by an undocumented person, right? So, you know, thank you to that undocumented person for that sandwich, that salad, that, right? Because you wouldn't have it. You just wouldn't have it. And so just like reminding people that these folks in your restaurants, and, you know, they add a lot of value to your life. The women who take care of your kids, they add a lot of value to your life.
I'd like to, please, I'd like to open it up to the audience and to the folks watching on the webcast. And I'll actually start with a few of the questions that were emailed in. And if folks have questions that they'd like to ask, I'll also give you the email again. It's events@clasp.org. So events@clasp.org. This question comes from Patience Quinn Chaplin. And Patience is asking, which is more important, for parents to work as many jobs as they can, for parents to spend as much time as possible reading to their children when they're not working, or for the U.S. government to sponsor high-quality, full-coverage daycare for all children from 6 weeks through kindergarten?
What was the last point?
The last one was for the U.S. government to sponsor high-quality, full-coverage daycare for all young children 6 weeks through kindergarten. I think the mayor knows a lot about that.
So the question was, what's most important
What's
for
more
parents?
important?
So I guess I would say a couple things. First of all, to the extent that the underlying point of the question is that being a terrific parent and working, let alone and going to school, is really hard, I actually think that's a central point and the crucial one to talk about. I'm a big believer that we ought to be thinking about parents having a mix in their lives of work and parenting, and that that paid family leave in the earliest months and high-quality early care after that are where we're going to have to get to as a nation. But I want to note that that doesn't mean parents don't read to their children. Parents are crucial caregivers. We know from all the research that there is that parents' investment matters. So I'd be a little bit on the all of the above front, though I would say that the policy changes that are needed to make it possible include changes that affect work and changes that affect particularly the early years of life.
I would agree and just follow up a bit by saying that parents can't do it themselves, and the federal government or state and local governments can't do it themselves. Many parents are already working as many jobs as they can, or as many jobs as they can find, which are hard to come by these days in this economy. Many parents are reading to their children. Increasingly, parents understand ways and are learning ways that they can work with their children to help them be more successful in school. But at the same time, it's also the responsibility of the federal government, that is to say all of us, to provide the resources that these families need to really take care of themselves and to make sure to help their children be as successful as they can possibly be. That's the promise of America, and that doesn't mean, I mean, we each have to do what we can, but by working through governments, government also is responsible for doing that. And so I would certainly be in favor strongly of all three, and it's hard to prioritize. I think without all of those, it will be very difficult to move forward.
I hope that we wouldn't view some of those things as mutually exclusive either, because I think if there are parents who have to work long hours, being able to have high quality, early education is a way of helping to support what it is that they're doing. And frankly, the parents that I know, those who work long hours, also find a way to be involved, in many instances with their children and with the educational environments in which their children are being served. Under the current federal administration, two of the most important policies to me, one is the Affordable Care Act, of course, which is the first time that health care has ever been made available to everybody who wasn't covered. And then the emphasis on early childhood education, which the President and the Secretary of Education, Arne Duncan, have really underscored. They probably have put more money into those areas than heretofore has been the case, although we've got a long ways to go. What I shudder to think, frankly, is that there are some who, if they had the power, would right now repeal the Affordable Care Act, and where would we be? And what's going to happen to these early childhood education policies once you have an inevitable change of administration? America, people need to understand that America is perceived by many to be the leader in education, and we are not. We're not anymore. We're not in the top 10 internationally. We're not in the top 20 internationally, and we are barely now in the top 30 internationally. We are not competing, ladies and gentlemen, and unless we do something different, and that is begin to intervene systematically and in an organized way at the earliest possible points with our children, we are going to continue to fall behind and lag. And that means we will not be global competitors. We have lots of people who come from other places around the world to be educated at the secondary and post-secondary level, but frankly, those folks are going back home and educating their, the folks where they live, and increasingly America is not being competitive with other nations. It's unconscionable that we sit here today and say we are 28th or 29th in education internationally, because that is exactly where we are. And some of that is the failure to invest in the support policies over the long haul. It probably sounds like an oxymoron, but you need, as an advocate, you need to have a sense of urgency, but you have to be in it for the long haul also. because things just don't, major changes don't take place quickly, but that doesn't mean you sit there and say, I know this is going to take 35 years. You always have a sense of urgency, recognizing that change doesn't come quickly or easily.
Thank you, Mr. Mayor. We have Mike in the center of the room for audience questions as well.
Hi, my name is Michelle Sternthal. I'm with the Jewish Council of Public Affairs. I'm very struck by the potential success of the Workforce Innovation and Investment Act and in this hyper-partisan environment, how this bill is actually able to get passed. And so I was wondering, what recipe for success does this bill demonstrate? And perhaps maybe more relevantly for you, what is the effective or winning framing around these issues that you think in less hospitable environments may be most effective to garner bipartisan support?
Well, we've just been talking about this at CLASP, and I see some of my colleagues here, so Vicki, if you want to add after I comment. I think it's a puzzle, right? How did something bipartisan that we expect, if it passes, is going to be good for low-income people, how did it happen? And some of the items we've been thinking about, one is, it's what the mayor said, urgency but sticking in it for the long haul, right? Many of the people working on it at many organizations, including CLASP and in the congressional staffs, have been working on those details for a very long time and bringing the knowledge they learned from the experience of people in the field. A second lesson is maybe less universally available, which is sometimes the right level of being under the radar screen is helpful, right? Some things do best with big visibility. Other things maybe do best when they're practical and useful and would make a big difference, but it's not obvious. And I think there's also a lesson from the point that Gail made about public and private, though I think one of the challenges is that that's not necessarily applicable to everything we do, because the business community may not understand yet quite how much of a stake it has in some of these areas, may understand in others, but that combination is probably helpful here. Vicki, do you want to add anything?
I would just add one other thing, that it's about the politics. And making
The mic?
Usually that's not a problem.
Well, we're webcasting, so.
Hi, everybody out there in webcast land. Another thing I would just add is it's a political. So you have to be able to frame wins for both sides of the aisle in a piece of legislation if it's going to get through in a bipartisan way. And I think that really happened with all of the hard work among the staff in both the Senate and the House in this particular instance.
And I think that is a good lesson if you're trying to bring together community partners. Like if you're looking at a community-based organization and a college and a government, if you can frame a win for each one of those, and I think you often can, we don't think in that way, but you often can, that you can move ahead the agenda. So I do think it's an important way to think about it as a framework.
Any other questions from the audience? I'll read one more question that came to us from email. It's from Man and Matchett, and he's asking, how do middle-class individuals and families factor into this discussion? This is a struggling group as well who is finding it difficult to advance or maintain their current socioeconomic status.
I was recently, this may be not the best. I was recently at a meeting with a bunch of manufacturers because we do lots of work in manufacturing as well, and they were really seriously reflecting about quite frankly, the lack of investment that they've made in their workforce, the lack of training, internal training that they have done for many, many years, and how short-sighted that has been, right? And I think that's the reflective point. Maybe doesn't solve, but for many, middle class, working families, right? The training equation at the workplace, right? The growth that happens at the workplace, that has to be a priority for us as a country if we're going to be competitive, as the mayor said, right? And it's also going to be the way I think we're going to be able to keep people in productive work. more into more productive work, right? Because we do have people falling out of the middle class, right? Or fearing they will be falling out of the middle class, and that's just the basic disinvestment in education. And then I just say to those folks, while they're working, prioritize continued education, right? That there's a lot of things you can buy. There's a bigger home you can get into, but there's also continued education that you can get into, and you're going to have to do it. That's the new economy.
That's a good point. One of the things that we've tried to do with our early education programs, that's what universality is really about. It is not means tested. We have so many programs, probably for obvious reasons, but so many programs at the federal level that people can participate only if they are at a certain income level or below that. And the point that's being made about the folks who are middle class is absolutely critical, because oftentimes they feel left out. One of the things that we've done is to try to make pre-K3 and pre-K4 available to folks as public education is available. That if you want to participate in public education as a 7-year-old, we will make that available to you. Well, as a 3-year-old and a 4-year-old, it doesn't matter what your family's income is. It allows you to be able to participate. And from our perspective, one, it's raising the bar in terms of the educational outcomes for our children in the city. But these are people who we're keeping in the city, who would perhaps move elsewhere and take whatever tax dollars they pay and pay them in another jurisdiction. They frankly are investing in the education of their children, which allows us then to offer that education, to these families and these very young children in the city. So it's level the playing field for us. We have some anecdotal evidence. As one case that I'm very familiar with, where there was a family that was about to move out of the District of Columbia to move to New York, and they chose not to, and they wrote about it on a blog, and essentially what they said was that because of the economic benefit that they were deriving from having their 3-year-old, 4-year-old in a program that they didn't have to pay for, they decided to stay here. And then in the aftermath, they talked about also the fact that in daycare, quote-unquote daycare, they would have had to pay for it, but their child was actually learning more in a publicly supported pre-K3, pre-K4 program. And frankly, I believe that over time we're going to get more parents like that who will stay in a place because they're able to access a publicly supported education, and probably won't pay a lot of attention to the fact that they are frankly helping to pay for it themselves through their tax dollars. Mm-hmm. People don't care about that. If their children are learning and they have access to services that are available to them as a taxpayer, they will continue to support that.
I just have one final, I know that we've run out of time, but I do have one final question, just sort of parting thought. Each of you, if you can give us one next step, well, sort of what has to happen when folks walk out this door. We can start with Dr. Hernandez.
One next step. I don't know, I keep saying all of the above. I think that people should go out and look for opportunities in their own lives, in their own places of work, in their own political communities, to identify situations where they can make a difference. Really focus on the needs of children, really of their children and of other children, and to think especially, I would say, about early education. We've talked about that a lot. It really begins, education begins at the earliest ages. We know that investing in early education is incredibly important. The middle class suffers the same kinds of stresses that the working class and other folks do. To the extent that we can move forward with high quality early education, high quality education generally, maternal and paternal leave, flexible work schedules, these will help every American. And so think about where in your life, where you fit into those, and what you can do to make a difference.
It's similar. I think it's organized. It's actually get people moving towards their interest and reaching out to others that have similar interests.
Yeah, I would ask everyone, particularly in my field, so all college professors and college administrators, to put on a lens, and in that lens they can see, oh, all my students are parents too.
So building on all those, I'm going to ask everybody to think honestly about the biggest way you're failing to meet your current organization's goals because you haven't taken this perspective. One of the things that I think came through earlier was the idea that reaching out to somebody often comes from a sense of discomfort, that actually you can't do everything you mean to do because of something that's interfering. So I would put your finger on where you're frustrated and look for the way that you can reach out to the other generation of services to fix that.
I'm going to make my next step rather narrow, and that is, as we focus on the continued proliferation of quality early childhood education, let's advocate for having more males involved in teaching kids at that level. I spoke at a conference recently that had about 500 people who were in the room, and it was on a riser, and I was able to look out over the room, and there were not 20 men in that room. We need more men involved in teaching our kids at the very early stages because so many of these children come from female-headed families and households, and then it's replicated when they go into an early childhood education program. So we ought to start to measure quality of early childhood education with one of the measures ought to be the diversity of those who are teaching.
Wonderful. Thank you all so much. It was very educational for me. I really appreciate it, and I'm sure the audience did as well. Thanks again.
Thank you.